Ibuprofen, the trade name is Advil. The pharmaceutical class is a non-opioid analgesics. The therapeutic is anti-inflammatory, antipyretic, and the action is inhibits the prostaglandin synthesis. The indication is for moderate severe pain, moderate pain, and fever. This medication is taken PO as well as IV. We're going to assess the lung, and now we're going to assess the vitals as blood pressure, respiratory rate, temperature. We're also going to assess for rash of SJS, also known as Stevens-Johnson syndrome. We're also going to assess for GI discomfort or GI such as black tarry stool. We're also going to be assessing for GI upsets, GI cramping, and GI bleed. We're also going to assess for AST and ALT. And for patient education, we're going to tell them to not take it more than 3 days. After 3 days, they need to go ahead and consult with the doctor. And this medication is not for long-term use. It may go for liver damage. Educate patient about taking this medication with so avoid alcohol, because this medication causes GI bleed, so we want to avoid taking this medication for a prolonged time. So avoid alcohol, avoid CNS, and avoid other NSAIDs with this medication. You also want to educate patients to avoid driving until known of medication, because it may cause dizzy and drowsiness. You also want to educate patients that if they have abdominal cramps, rash, particular for the abdominal cramps, because it might cause for GI. So let's just talk about that. So for the GI, we want to tell patient to see the HCP if they have black tarry stool, abdominal cramping, to notify the HCP. We also want to educate the patient that if they have a rash, an unknown rash, it could be SJS, that they need to go to notify the HCP.